I am so excited to be here, and it's standard to say that, but I really am. If we only had one person here, I would be excited because, for instance, we have one pediatrician. The average clinic or the average patient load for one pediatrician is about 1,200 patients. And what I'm going to present for you today will give you a very simple, very easy, very powerful tool to change your patients' lives, to improve their health, to improve their emotional well-being, to improve their futures. It's really a rather striking and very simple idea. I've given this talk before to the Pediatric Society. Brent and Gibran were both there. And in reworking it, getting ready for this, looking at the information I had, I realized that if I can convince you to do this with your patients, this may be the most important medical lecture you ever have. And that sounds like a pretty loud boast, but I hope if you stay with me, maybe by the end I will have convinced you. So to understand this, we need to have some shifts in the way we look at medicine. You've probably seen this before. You save one life, you're a hero. You save 100, you're a doctor. How many of you in here feel like you've saved 100 lives? Anybody? You have you? All right. So most of us would say no. And that is that's the beginning of why we need to rethink what we do. First, a little shameless self-promotion. This was my recent book, won quite a few awards, but in it I took ideas from psychiatry and ecology and applied them to the sweep of history. And one of the most important was an idea in ecology we call carrying capacity. It comes to us from Malthus. You will remember Malthus from your biology classes, that all populations will outstrip their resources, their food supply. Well, that means that all the excess will die or must die somehow. And so we have a few simple tools that I applied to the human condition, pulled the best numbers I could find, and it was a pretty rough estimate, but as best I could ascertain, before the last couple of centuries, 3/4 of the human population died every generation. That is hard for us to fathom today. Science is basic, but people died of exposure. They died of starvation. They died of disease. They died of war. And that's one of the things the book really focuses on is the horrors of war. But still, the numbers seem to be, that sounds a bit outrageous. There is a modern example. This book, Death Without Weeping, Nancy Shipper Hughes, she went to one of the poorest virus, I think I'm pronouncing that wrong. It's a barrios in Brazil. And death is so rampant that when a mother has a baby, she puts it to the side, feeds it, changes its diaper, but has no interaction with it until it survives for a few weeks. If it survives, she takes it in and she raises it like the rest of her children. But if it dies, there's no big deal. She buys a little cardboard coffin, they have a party, and they take the baby and bury it. That is the incredible death rate among the poorer and undeveloped parts of the world. Again, in the modern world, it doesn't seem rational that 3/4 of the population, but it's strong science. So when we think of saving medicine, or saving lives, excuse me, this is what we think of, right? I already gave this away. This is my punchline to Gibran. Does anybody recognize this guy? He's a Lebanese guy from Lake Charles. This is Michael DeBakey. He did the first American cabbage. It was not the first cabbage. The Russians invented it, but we don't talk about them because they're godless commies, right? So, but this is what we think about. But in fact, all of you who practice medicine here have probably saved 100 lives with this, antibiotics. People died in centuries past without antibiotics. The kids you see who have a strep throat or a pneumonia or a sinusitis or an otitis media or even acne, in past centuries they would have died. And you have probably, all of you, if you've practiced for any length of time, have saved over 100 lives. But unlike Michael DeBakey, you can't point to them. You can't say, I saved that person's life or this person's life. And this is a big sea change in how we practice medicine and how we perceive medicine. when I was in med school, they showed us a video, Patton MD, for those of you who aren't old enough to have seen the movie Patton with George C. Scott. He opens it with a talk to his troops, and he has this gravelly voice. And in this video we saw, a man comes out, ostensibly a surgeon, and proceeds to lampoon psychiatry. And he says, operate, medicate, radiate. So when your grandson is sitting on your knee and he asks you, Grandpa, what did you do in the Great War on disease? You won't have to say, son, I practice psychotherapy. Well, and earlier in the talk he says, no bastard ever cured disease by talking to it. And that's a big sea change too, because in fact, I'm going to suggest we do. To start, I want to go back to this. You've all seen it before and rapidly forgot it, as you should. This is a map of 1854 Soho in London. There was a horrific cholera outbreak. And a physician by the name of John Snow, together with a cleric by the name of Henry Whitehead, went door to door asking who had cholera and who had died. And they put together this map. The little squares are the cases that they found. And they also added to it the locations of the pumps and the water pumps, because they suspected that's where the cholera was coming from. And sure enough, the cases all centered around the Broad Street water pump. In England at that time, in the 19th century, water companies competed. And so the water at one pump might come from a different company than the next pump. And in this case, the company in charge of the Broad Street pump was getting their water downstream from the Thames River. And the rest of them were getting it upstream from the Thames River. So they were picking up cholera and repumping it into the city. And if you go to Soho now, you will see this monument. It's a replica of the water pump. When John Snow took his map to the church officials, they removed the pump handle. And so this is, like I said, a monument to both him and that epidemic. If we jump 100 years later, about 100 years, this is deaths from heart disease in the United States, and you can see it was starting to rise in the early part of the 20th century, and all of a sudden, around 1960, it started to drop. Why did it drop? Because 12 years earlier, the National Heart, Lung, and Blood Institute launched the Framingham study. They started following 5,000 people in the city of Framingham for one disease, heart disease. This study is still ongoing, but from that, this is where we found out that smoking, diabetes, obesity, what are some of the stress, hypertension, are big, and cholesterol are big risk factors. And because of that, within 12 years, their findings started coming out and informing the rest of us in the medical profession. And we started to see a drop in heart deaths. This is modern epidemiology. Some of you may have seen this diagram before, social determinants of health. Socioeconomic factors, health behaviors, and 20% of it is healthcare, which might sound surprising, but you've got to remember, we step in when the natural system goes wrong. Most of the time, people are healthy, and it depends on the things in their lives. The two that are of particular interest to me are the health behaviors and the socioeconomic factors. And I'm talking to some of the people at UL, and if you're not familiar with what UL is doing in medical research, you need to find out. UL has the largest primate center in North America. It has one of the largest in the world, and they've gotten substantial funding from the state government to build a bioinnovation lab to create new drugs, pharmaceuticals, procedures, and then a level 3 testing lab to test them in humans, which would be the phase 1 trials that Gibran was talking about. And I'm interested in these because to do research in those areas, we can start pulling in areas that would not normally be included in research, including the College of Education, the College of Liberal Arts, and the College of Business, particularly marketing. If we need to change our patients' behaviors, we need to understand what changes their behaviors, and the marketing people will be some of the first people we need to talk about and talk to. Which brings us back to the statement, so you won't have to say, son, I practice psychotherapy. Well, in a way we do. What we do is we practice preventive medicine, but so much of that is talking to our patients, trying to persuade them to think differently and act differently. And in a way, it is a kind of psychotherapy. This is an exciting area for those of you involved in research. Here is the NIH funding for preventive health research. In 14 years, it's doubled. It's gone up over 12 billion. And this is only one of the agencies federal agencies doing research. And there are also private foundations that are looking at preventive health research. So this is a rapidly growing field. There's a lot of things to be discovered there. This brings me back for a second to some of the things that Brent talked to. When we started medical school, they taught us primum non nocere, nocere, if you speak Vulgate Latin. First, do no harm. One of our standard saws in medicine. But for me, there's another one, that we should treat the disease and not the symptom. This was a great epiphany for me. I was doing emergency medicine, and if I get in a young man with a knife wound, if nothing serious is damaged, I can patch him up and send him on his way. But I haven't taken care of the disease. If I get a little old lady in whose blood glucose is out of whack, she hasn't gone into DKA, I can fix her up right there in the ER, send her on her way. A mid-level manager's got headaches, insomnia, peptic ulcer disease, hypertension, who knows what else. We have medicines for each one of those things, but we're not treating the disease, we're treating the symptoms. And so in 1989, we started the Acadiana Educational Endowment to look at education. And as we worked on it, the recession a few years wiped us out, and I raised a family, and we lived in Spain for a year. But while I was there, I kept thinking about this, and we came back 5 years ago. We started this project, Reading with Kids. In the ER, I would talk to parents about reading with their kids, and if we have some time at the end and you're interested, I'll be glad to tell you a couple of them. But I would get back these great stories. Parents would come back to me. Sometimes I don't think the parents could read much themselves about what an impact it had on the child's life. And so I started talking a lot about reading to children. This is an interesting picture. I finally found the caption here, and the soldier reading to this little boy is not his father. Does anybody have any idea why? It's his mother. These are some of our prejudices we have about different things. One of them is how medicine is practiced. The other is that a soldier is going to be a man. Reading is not entirely new to pediatrics. The Academy of Pediatrics, of course, has Reach Out and Read. However, when I started this 5 years ago, the recommendation was to start at 6 months. And I was saying to people, we need to start at birth. The Pediatrics Academy of Pediatricians has updated that. They now say start at birth. But now I'm saying that's too late. In 2023, the French did a fascinating study where they had parents read and speak to their children in the 3rd trimester. Little babies came out, they slapped an electrode cap on their heads, and they could show that the neural processing centers for language were already advanced over other babies. So we should start reading to our children when they're pregnant. However, I have gone beyond that, and I have started telling people, read to your babies before you're pregnant. Now that doesn't seem to make much sense at all, but we're going to get to this in a minute. Reading with your child strengthens the bond between the parent and the child. So the parent can start working on their side of the bond before they're pregnant. Second of all, we know about maternal effects. We should hope that reading and bonding with the child will strengthen those maternal effects, and the baby will grow in a healthier environment. Third of all, I tell my patients, when the baby comes, all hell breaks loose. You need to have established that pattern of reading before the baby arrives. And then there's a fourth reason, if you're of a spiritual nature. Your baby's out there somewhere. You're communing with them, if you are of that perspective on the other side of life. So that's a big thing. Read to your child when you're pregnant or before you're pregnant. And one of the next things that we need to do, Brent's going to help me, I hope, we're going to go talk to the obstetricians and get them working with us. Most of the rest of this is pretty fast, a lot of statements. The research is on our website, readingwithkids.org. but you need to understand how powerful this is. 2/3 of students who do not read proficiently by 4th grade will end up in jail or on welfare. 90% of kids who struggle to read in 1st grade will be those kids in the 4th grade. And if you put those two numbers together, 60% of children who are not ready to read by 1st grade will end up in jail or on welfare. What is the cost to society? What is the loss of human potential? Reading with children fosters brain development, bonding attachment. We've talked about that. It benefits the child. It benefits the adult. We've mentioned that. In low-income families, it expands parental warmth and decreases parenting stress. So it makes the whole family better, reading to your child. Involving families in language is important to preschoolers' development, helps them in that way. Children who read for pleasure, which we hope that children who are read to will do, tend to do better in school, in college, and have stronger writing skills, which is a key to almost every profession. Children with reading problems, this is one of the biggest ones, are increased risk of teen parenthood, substance abuse, and being a greater economic burden. Includes crime. They're more likely to become involved in crime. Here's a big one. Low literacy leads to poorer health. Uneducated people are more likely to be sick. Patients often can't even understand the medical materials we give them on discharge. America is reading less and less well, diminishing employment and income. Again, huge economic impact. It's a huge potential that we have here. Finally, and these are also on the site, they bolster life skills. They make us smarter, more cooperative, and more compassionate. The philosopher David Hume argued we do not learn morality from philosophy or religion. We learn it from literature, by seeing the world through other people's eyes. And when Abraham Lincoln met Harriet Beecher Stowe, he is supposed to have said, "So you're the little lady who wrote the book that started this great big war." And indeed, it was not the typical arguments of slavery. It was a story, Uncle Tom's Cabin, that really galvanized the country and brought a greater awareness. Finally, libraries and museums are also important, and we want to encourage that at some point. And the potential here is large because Louisiana ranks near last in childhood well-being. So that brings me back to that earlier diagram because I want to show you something. Think about it. Socioeconomic factors are the largest factor in our patient's health. What tool do we have in medicine currently to address that? I've been thinking about that for a long time. The only thing I can think of is like Ritalin that might help a kid get education. But other than that, nothing we do in medicine affects the most important part of our patient's health until tonight. Because what I talked to you about was reading and getting parents to read. We hope to get to some research on this. UHC currently doesn't really do any research. There's a great potential there. And the beauty of it, it is next to the Cecil J. Picard Center for Child Development and Lifelong Learning. And reading contributes to that. Lifelong learning is a fancy way to say curiosity, right? Curious people continue to learn. So, as physicians and as practitioners, what can we do? Well, you already know where I'm going with this. In a few seconds, if you talk to your patients about reading, ask them, are you reading to the child? Whether they say yes or they say no, this is on our website. One of these pearls would pop up. You mention one of these. We'd like the nurse to do it while she's doing, he or she is doing the intake interview. We would like the physician to do it. Takes a few seconds. Are you reading to the child? Let me tell you what it'll do for them. Quick as listening to their heart and lungs. But what an impact it will have on so many children's lives. We, and Brent has helped a little bit with this, we were trying to get it worked into the EPIC electronic health record. Javon, what do y'all use for your well, then maybe we can, if you're interested in this, we can have the pearls pop up when a patient is being seen. It just takes a second. We took this to pretty high up and thought we were going to get it done. We got derailed. We're going to go back to it. There are other things we can do too, because as physicians, it's not just that we're saying it. We're saying it as the most probably impressive authority figures our patients will see. We are the best educated people that many of our patients ever meet. We are some of the most prestigious. I told the pre-meds when I was working with them at UL, one of the highest titles our society gives out, and In the United States, we don't give out a lot of titles, but one of the highest is doctor. The only one I can think of that's equivalent to it in the community is judge. Doctor is very, very impressive. So when we encourage it, and this is something I've experienced in the emergency room, in fact, it's been my impression that the more at risk the parent and the child are, the more receptive they are to what I'm saying, because they know their children are at risk. And if I can give them something simple and easy to do, they grasp at it. So there are other things we can do because, again, we're very prominent in the community. Always carry a book, particularly women. Women should carry a book. Well, and I made sure I brought mine. So always carry a book. Read in public. When my daughter goes to Art Walk, I will often go to the bar near the Festival International stage. They have a nice sofa by the bar. I'll order a drink and read a book. Read a book. Let people see you. Start a book club. You can start it at work. You can start it in your neighborhood. You can start it with your friends. Start reading. Start encouraging other people to read. When someone is pregnant, have a book shower. Have everyone bring a book for the baby. One of the things I suggest is have an empty book, a blank book, and everybody there has to write a story or draw a picture for the baby, and it will be the baby's personal book. Another thing to do is, and this is a teacher with a young man, but I joined Big Brothers Big Sisters, and once a week would go in and work with a really sharp young first grader. We would read. We would also do some paper folding. I was trying to get him to origami. So many of us are too busy for that, and I understand it, but get involved. This was where I was telling people to get books now, but we have our own, and Gibran has graciously offered to buy 10 of them, 10 boxes for your clinics. Gibran, I hadn't showed you this yet, but Delta Children has these lovely little bookshelves, and they're not very expensive, particularly ones on sale. And if you don't want to go direct to them, almost every major retailer offers these. And the last thing I promised someone with the school board, I would always talk about this. There is the school readiness tax credit. And this is a thing you fill out a simple form, and your tax dollars go to a preschool. Doesn't cost you anymore. It just shifts the money. The state says, we will take part of your money and put it in a preschool or a daycare center. So that's what I've been working on all these years. I'm excited you're here. If you can take this out and spread this, Gibran, you're in a position to really make it powerful. We can get this going. And again, I don't know who would do the research on it, but it would be fascinating to follow those young people, find out how much they read, and find out what happens to them over the course of their careers. Thank you.